Hello and welcome back to GP Video Podcast by Nadia. These days, my circumstances are such that I'm not able to make regular and long video podcasts that I was doing before. But anyways, whenever I get a chance, I will do them. But I also thought that because I cannot not be doing them, so my idea would be that if I can do short podcasts and just give out a message that I would like to give out to my beautiful audience. Anything that is important for me and I would like to share with you at the end of the day, that would be great. So today's message is about perinatal mental health. What is perinatal mental health? It is mental health of the woman during both antenatal period and postnatal period. What is antenatal period? Antenatal period is when the entire 9 months after conception, and the postnatal period is anything after delivery up to 6 months. So perinatal mental health is very, very, very important, and we often ignore women's mental health during this period, and it can be anything can be happening in this period, like anxiety, depression, obsessive compulsive disorder, psychosis, bipolar. Anything can be flared up or can happen. So there would be two kind of women: one with the previous mental health issues and one with no mental health issues. So who is more at risk factor? The women who have had previous mental health issues are more at risk for developing perinatal mental health issues as well, while the women who have not had any previous mental health issues are still prone, because sometimes what happens is they haven't had a because childbearing or giving birth to a child is also could be quite traumatic, and could be quite dramatic, could be quite too much for a woman. So even a woman who has not had any previous mental health issues can definitely have mental health issues during this period. But yes, women who have had mental health issues are actually a bit more at risk. So my message for today was, I'll talk about it more in detail because it's a very, very, very vast topic, and it's a very, very, very important topic. But my message for today is that if a woman who is on antidepressants and are either coming to you to a GP for a prenatal conception advice, or they've become pregnant and they have come to a GP for antenatal advice, please do not knee-jerk stop antidepressants. Yes, there are some antidepressants that are not safe during pregnancy. They can always be changed to the antidepressants that are safe. And the most convenient SSRIs these days are mostly very, very safe. Especially sertraline is quite safe. We can always check the guidelines. We can always check all whatever medication the patient is on, and can always check the safety during pregnancy. That's not a problem at all. But please do not knee-jerk stop the antidepressant if, for example, because the fetus is going to be really harmed because of when you go off antidepressant just like that, suddenly you're going to have high cortisol levels because of stress. Your mental health is not going to be good, which is going to affect your physical health, and which is going to eventually affect your kid's health, your child's health, or your fetus's health who is in your womb. So do not jerk. So if you really are very careful about the side effects, then please do a preconception arrangement, or a preconception counseling session, or a preconception preconception is the best. Like, preconception means before conceiving the fetus. So if you see your GP before conceiving, he or she can do all the blood tests, including the genetic carrier screening, both for you and for your partner, to just see whether you guys carry, for example, both of you carry the gene for thalassemia, or both of you are positive for hemochromatosis. So anything, you can do all the blood tests, you can do all the genetic carrier testing, and then you can also discuss, if you are on an antidepressant, you can also discuss that with your GP and see how safe it is. If it is not safe, then which option you can change it to, because stopping antidepressant as in like knee jerk just like that, will affect your mental health, will affect your physical health, and that will affect your high cortisol levels, are going to affect your fetus as well. So that was the message for today. We will explore this topic in detail next time.